Trastuzumab, also known as Ogivri, is a medication used to treat certain types of breast, stomach, or esophagus cancer. It is specifically used to treat tumors that produce more than the normal amount of a certain substance called HER2 protein. Ogivri belongs to a class of medications known as monoclonal antibodies, and it works by slowing or stopping the growth of cancer cells. It is available in the form of a 150 mg intravenous solution, and the recommended dosage and timing for taking this medication should be determined by a healthcare professional based on individual needs and medical history. It is important to follow the prescribed dosage and administration schedule for the best results. When it comes to taking Ogivri 150 mg intravenous solution Antineoplast EGF receptor blocker Recomb monoclonal antibody, it's important to know that this medication is typically administered by a healthcare professional through a slow injection into a vein. This is usually done once a week or once every 3 weeks, with the first injection taking at least 90 minutes. The dosage of Ogivri is determined based on your medical condition, response to treatment, weight, and other medications you may be taking. It's important to communicate with your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. To get the most benefit from Ogivri, it's essential to use this medication regularly. You can mark the days on your calendar when you need to receive the medication to help you remember. In some cases, your doctor may also prescribe other medications, such as acetaminophen or diphenhydramine, for you to take before each dose to help prevent serious side effects. It's crucial to follow your doctor's directions carefully to ensure the best possible outcome. Some common side effects of Ogivri 150 mg intravenous solution may include redness or irritation at the injection site, diarrhea, muscle/joint/back pain, stomach/abdominal pain, headache, trouble sleeping, nausea, vomiting, mouth sores, and loss of appetite. Your doctor may prescribe medication to prevent or relieve nausea and vomiting, and eating several small meals, not eating before treatment, or limiting activity may help lessen some of these effects. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects for most people. However, you should tell your doctor right away if you experience symptoms of heart failure, bone pain, numbness/tingling, mental/mood changes, fast/irregular heartbeat, easy bruising/bleeding, or signs of infection such as a sore throat that doesn't go away, fever, chills, or cough. Trastuzumab, the active ingredient in Ogivri, may also cause a rash, and in rare cases, a severe allergic reaction. If you notice any rash or symptoms of a serious allergic reaction, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you have any concerns about the side effects of this medication, it's best to consult with your healthcare professional. Trastuzumab, also known as Ogivri, is an intravenous solution used as an antineoplastic, cancer-fighting, medication. It works by blocking the EGF receptor and is a recombinant monoclonal antibody. It is commonly used to treat certain types of breast cancer and stomach/esophagus cancer. It's important to be aware that trastuzumab may cause serious heart problems, including heart failure. If you are also using an anthracycline, such as doxorubicin, the risk of heart problems may be increased. Your doctor may stop treatment with this medication if heart problems occur. Reactions may occur with your injection, typically during or within 24 hours of the dose. Close monitoring may help decrease your risk. If you experience symptoms such as fever, chills, flushing, headache, nausea/vomiting, trouble breathing, dizziness, weakness, or feeling faint, it's important to inform your healthcare professional right away. Your doctor may slow down or temporarily stop your injection if necessary. Furthermore, trastuzumab can cause serious harm to an unborn baby if used during pregnancy. It's important to discuss reliable forms of birth control with your doctor if you are considering using this medication. The recommended dosage of trastuzumab is determined by your doctor based on your medical condition, response to treatment, and other medications you may be taking. It is typically administered once a week or once every 3 weeks, and the optimal timing for taking this medication should be discussed with your healthcare provider. Before starting Ogivri 150 mg intravenous solution, make sure to tell your doctor about any allergies you have, as well as your medical history, especially if you have had recent infections, heart disease, lung problems, or previous cancer treatments. This medication can increase your risk of getting infections or make existing infections worse. Avoid contact with anyone who has a contagious illness, and talk to your doctor if you have been exposed to an infection. Let your healthcare professional know if you are using Ogivri before getting any vaccinations. Also, be cautious with sharp objects and avoid contact sports to prevent injury while using this medication. Ogivri may cause dizziness, so be careful when consuming alcohol or using marijuana. Avoid driving or operating machinery until you know how this medication affects you. Additionally, inform your doctor about all the products you use before having surgery. If you are an older adult, you may be at greater risk for heart problems while using this drug. If you are pregnant or planning to become pregnant, talk to your doctor about reliable forms of birth control and the potential risks and benefits of using this medication. Additionally, consult your doctor before breastfeeding while using Ogivri. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, it's worth noting that Trastuzumab is very similar to Trastuzumab deruxtecan, Trastuzumab emtansine, and Trastuzumab hyaluronidase. Therefore, it's important not to use a Trastuzumab deruxtecan, Trastuzumab emtansine, or Trastuzumab hyaluronidase product while using a Trastuzumab product. If someone has taken too much Ogivri and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Before starting to use Ogivri 150 mg intravenous solution, it is important to undergo lab and/or medical tests, such as heart exams and complete blood count. These tests should also be done while you are using this medication. It is important to keep all medical and lab appointments. Make sure to take each dose of Ogivri 150 mg intravenous solution Antineoplast egg receptor blocker Recomb monoclonal antibody on time. If you happen to miss a dose, consult your doctor or pharmacist immediately for a new dosing schedule. This medication, Ogivri 150 mg intravenous solution, is administered in a hospital or clinic setting and is not intended to be stored at home. It is used as an antineoplastic agent and an EGF receptor blocker. It is a recombinant monoclonal antibody. The dosage and timing of administration will be determined by your healthcare provider based on your individual medical condition. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.